at least in the room. So we'll go ahead and get started again on the calendar. So now we're at agenda item 27C4, Northwest College Pomona Vocational Nursing Program. The NEC was Faye Silverman. Ms. Silverman, thank you for your report. We have it, and we've received it and reviewed it. And do board members have any questions for Ms. Silverman? Seeing none, is there a representative from Northwest College Pomona Vocational Nursing Program present? If you could state your name and your title for us.
Good afternoon. Adnan Al-Muazzin, I'm the program director, and I have with me Dolores.
Tariqas, ADON. Good afternoon.
Good afternoon. I'm Stella White. I'm the clinical coordinator.
And do you agree with the NEC's recommendation? And do you have any updated information?
Yes, we do agree, and it is updated.
Okay. Board members, do you have any questions for the school? John?
Good afternoon, sir, ma'am, ladies. Just kind of curious, in the report, your students were introduced to complex skills before mastering or being exposed to the simple skills. And that's kind of backwards, but can I figure out what happened? How did that occur where you're introducing complex skills before the simpler skills?
Yeah. It's, we did revise the instructional plan, the curriculum. Previously, we've had, in the first 7 weeks of the program during the nursing fundamentals, we were teaching all the skills in the skills lab before they start the clinical. And then we were instructed that we have to break it down from a simple to more complex later on. So in the new revised IP, the instructional plan, we made the skills lab in the fundamentals for only the basic skills, the most fundamental one, and we moved the more complex one in the second term and in the third term.
Okay. The reason why I'm asking is that nursing schools have been usually a progression of skills where you have to tie in the theory to the lab before you're able to practice in clinics, because real life patients should not be the first time they deal with it. And to do something like wound care versus something like vital signs, to something like staple removal or something else, is kind of hard when the student has no idea of asepsis or aseptic technique. They may know how to wash their hands, but I don't know if they know their ABCs type of thing. And when I read that, I was kind of like, no. Because we've known each other for a long time. Your school has not been like that. So I had to ask what happened? Because it's like you got to learn to crawl before you can run, and you have all those other steps. And to expect a person to run when they barely just started to crawl just did not make sense. The other thing is, as I stated earlier, the theory application. Expecting students to be able to perform complex and not understand the why they're doing it. Why is it aseptic? Why do I have to make sure about adding to a sterile field correctly? Why do I have to have all my equipment assembled? Why do I have to check the order?
Yeah.
And to expect somebody to master that without understanding the very basics, not only is it expecting the student to do much, but it's also quite possibility harmful. They're expected, once you've taught them the skills, they think they can go out and do whatever they want to. Because, face it, nursing students are like puppies. They want to learn, I'm sorry, I shouldn't have said puppies, but they're that eager. That's the joy of teaching, is that they want to learn. And we teach them to do the skills, and the first thing you want to do when they get to clinical is do the skills. But if they don't have the theory behind doing it and doing it correctly and understanding why they have to do it step by step correctly, it's almost like putting a loaded gun in the hands of a child. It's that dangerous.
Yes.
Nosocomial infection being the first thing that comes immediately to mind. So I had to ask why this question, because I've never seen it in a report where school is teaching things backwards, for want of a better word. So I'm assuming, in reading the report, this has been corrected,
Yes.
and it's reflecting in your curriculum
Yes.
and your lab?
Yes.
I am so glad to hear, because I'm hearing, my heart's starting to beat, going, oh my God, they're giving injections, and they don't know to wash their hands before they give the injection or assemble the equipment. And I'm just making this up, I have no idea, because there's no details here, but those are some of the basics that students, if we don't reinforce it, because we can show them once, and they think they know it, I've, come this close to getting stabbed by a student with an uncovered needle. And so I just want to make sure that this is hammered in. Is that we got to make sure they can crawl before they can walk before they can run, and when they run, let them free. But again, simple, basic to more complex.
Yes.
Because without the theory to back it up, they don't have that understanding, comprehension. And what I teach my students is they have to know why we do it. They have to have that basic theory behind it before we can teach them the skills. So when I saw that, I just had to address it with you.
Yes.
Thank you.
Any other questions from board members? Yes. John?
Motion to accept the NEC recommendation as presented.
I'll second. There's a motion and a second. Any further public comment? Seeing none, further discussion from board members? Seeing none. So it's been moved and seconded to accept the NEC's recommendations. We'll do a roll call vote, starting with Eric,
Yes.
Todd,
Yes.
Andrew? Yes. Samantha? Yes. Myself is a yes. Bernice?
Yes.
John?
Yes.
Donna?
Yes.
And John?
Yes.
So the motion carried unanimous. Thank you.
Thank you.
So we're on agenda item 27C5, Pasadena College Vocational Nursing Program. And the NEC was Faye Silverman. Ms. Silverman, thank you for your report. We have received it and reviewed it. Do any of the board members have any questions for Ms. Silverman? Seeing none, is there a representative from Pasadena College Vocational Nursing Program? And if you could state your name and your title for us?
My name is Carla Christensen, and I'm the director of the vocational nursing program at Pasadena City College.
Donna Nielsen, I'm the assistant director, Pasadena City College Vocational Nursing Program.
And do you agree with the NEC's recommendation? And do you have any updates of information?
We do agree, and Faye did a wonderful job.
Thank you.
And there's nothing to add to what she already put in her report.
Thank you. Do board members have any questions for the school? John?
I like that look. It's like, oh, God. You looked at each other, it's like, oh, God. I'm sorry, lady.
We're not nervous.
No.
We've never done this before.
That's quite all right. Now, if I remember correctly, you two ladies restarted the program.
Yes.
And you have had a rough road. And I'm hoping, looking at your past rates, you're climbing out of that tunnel into the light. And I just wanted to say, good job.
Thank you.
You have been working hard, especially when you start, it's a startup program. And I know you've been going at it for a while, and the two of you have worked together. And I like the direction you're going. And I do wish you continued success
Thank you.
and keep moving in the right direction, because it's not easy. Especially with the startup program. I've been involved with startup programs before. But it's heartening that you are moving in the right direction. So my only words to you are, keep going.
Thank you, thank you. The last quarter is really the first time our graduates have taken the NCLEX, so we were really quite pleased with the 92%.
Yeah. I know a lot of schools would love to have that.
See, it's not a problem.
Samantha?
Yeah, I just, something that John had said, you said your school was shut down for a time? Or you had no students, or?
what
I know
we-
PCC's been around for many decades,
Yes,
so.
since 1948, we've had the
Yes.
nursing program. What happened was our previous director retired, and it coincided with the graduation of our 2014 students. We have a new class every year. We only admit in the fall. And so given that, and I was hired as the director, I wanted to take a year, not admit students for 1 year, and take some time to look at why was the pass rate as low as it was starting to get. Because PCC historically has had a very high pass rate until recent years.
So how, when did you restart the program?
So we
per se?
restarted the program fall of 2015. So we just took 1 year, looked a lot more closely and made some different plans.
And how many cohorts? You've just put through the one cohort?
Just one,
And so the data we have is on that one?
yes,
Okay,
yes,
thank you.
yes.
Any other questions from board members? Seeing none. John?
Motion to accept the NEC recommendation as presented.
Second.
So there's a motion and a second. Any public comment? Seeing none. Any further discussion from board members? Seeing none. It's been moved and seconded to accept the NEC's recommendation. We'll do a roll call vote, starting with Eric.
Yes.
Todd?
Yes?
Andrew?
Yes.
Samantha? Yes. Myself is yes. Bernice?
Yes.
John?
Very much yes.
Donna?
Yes.
John?
Yes.
So motion carried. It was unanimous, and thank you.
Thank you.
That takes us to agenda item 27C6, Platt College Vocational Nursing Program. NEC was Faye Silverman. Ms. Silverman, thank you for your report. We've received it and reviewed it, and I'll open it up to any board members who have any questions for the NEC. Seeing none, is there a representative from Platt College? And then if you could state your name and your title? Thank you.
Good afternoon. My name is Rosemary Hagans. I'm the program director for Platt College.
And do you have any information you want to give, and/or do you agree with the NEC's recommendation?
I have no additional information. I do agree with the NEC's recommendations.
Board members, do you have any questions for the school? John?
I'm sorry, ma'am. Ms. Haggins?
Yes.
10 points? 10 points above state average.
Yes.
I think that'd bring a smile to your face.
Oh, it has. My God. It was hard work. It was a challenge. I've only been there for a year.
And looking at your past history, you should deserve you deserve or earned, take it back, earned an ear-to-ear grin. You've worked hard, and it's great seeing you coming back.
Thank you.
Back into
Thank
this level. And I know it's been difficult.
you. Yes, very
And
difficult.
I'm sure your college administration is also happy to see these results.
They're very pleased.
All I can say is keep going the way you're going. Keep your standards high. keep your students engaged and continue to grow. I think you are living, you and the other schools that are doing well are doing exactly what I hope, is producing professional, competent, safe LVNs for the state, because chances are, the way I keep walking around, I'm going to be one of their patients. But I wish you continued good luck, in all sincerity. You've come a long way, and keep going.
Thank you so much, and I'd like to thank Mrs. Silverman and Mrs. Anderson for their continued support. Thank you, and the board, of course. Thank you so much.
The NECs are the ones that do the heavy lifting, and they deserve all the praise the schools can give them. And I would agree wholeheartedly to that statement.
Thank you.
Madam President,
Yes?
if I may, I move that we accept the NEC recommendation as presented.
Okay.
Second.
Okay, it's been moved and seconded. Is there any public comment? Seeing none, further discussion by board members? Seeing none, it's been moved and seconded to accept the NEC's recommendation. So we'll do a roll call vote, starting with Eric.
Yes.
Todd?
Yes.
Andrew?
Yes.
Samantha?
Yes.
Myself is yes. Bernice?
Yes.
John?
Very much yes.
Donna?
Yes.
John?
Yes.
So motion carried, it was unanimous, and thank you.
Thank you.
So that moves us to agenda item 27C7, West Coast Ultrasound Beverly Hills Vocational Nursing Program. NEC was Beth DeYoung. Ms. DeYoung, thank you for your report. We've received it and reviewed it. And do board members have any questions for Ms. DeYoung? Seeing none, is there a representative? Oh, John?
I'm sorry. I'm sorry. Ms. DeYoung, I'm noticing that you did, or there was a unannounced visit in March last year. And I'm noticing that many of the violations have been corrected, but the one I'm concerned about is more towards the last page. Failure to submit qualifications for proposed faculty, mostly administrative issues. I'm assuming the program has corrected them all in your initial report?
Yes, all violations have been corrected.
Now, the key thing is that it's easy to slip and slide. By extending by approving these classes, we're not going to let them slip and slide back, correct?
That's correct. They currently have two classes, and one is due to complete March 2017. So that is one of the reasons why I approved both classes, because they will be down to one class. And the current director has been very compliant with all the paperwork. I have verified every single complete approval date, everything, and it matches the board approval. And with correcting all 6 violations, as well as their quarter NCLEX rates for the last 3 quarters have been in regulation with the regulations, I decided to approve all classes.
Very good. Thank you very much.
So is there a representative from West Coast Ultrasound Beverly Hills Vocational Nursing Program present? If you could state your name and title for us?
Good afternoon, board members. My name is Hani Nashed. I am the director of the nursing program, West Coast Ultrasound Institute, Beverly Hills.
And do you agree with the recommendations from the NEC? And do you have any updated information? If not?
Totally agree with the recommendations, and I have nothing to add.
Thank you. Board members, do you have any questions for the school? John?
Sure. I noticed that you've come a long way from where you've been. You've had a period of time when you were non-compliance with the requirements to have the appropriate number of graduates at the level that's required, which is 10 points, within 10 points of the state average, above or, below. And you've made improvements. The on-site inspection last year, pardon me, netted six violations, which you corrected immediately, which is encouraging. What I'm going to ask, and you've been on probation, but basically, please don't backslide.
I'm striving to do that.
I know sometimes that's hard, because human beings being what they are, people make mistakes, and we can understand mistakes. But once you got it at that level, the hard part is trying to maintain that level. And the only thing is, what happens when we start to lower it, the students start to suffer, and the school starts to suffer because of poor performance. So if you keep your standards high, once you have it up, try to keep it up, try to maintain it. You've had a long history of ups and downs, and I'd rather you plateau at the upper level, 80s, 90s, be nice even if you got to 100, but we wish that for all of our schools. But that being said, I just want to make sure that you understand, the board looks at all the schools individually, but we do have to maintain standards. The students that you graduate hopefully are going to go on to RNs, or they may stay in LVN. But given the way that it is in the state, all of us may be the patients of one of your graduates or all the other graduates.
Including
And-
myself.
Yes. And I do want to make sure that, knowing that an LVN from California is respected anywhere out in the nation, that they want our grads, is the level I hope to have helped build as a member of this board, and the only way I could do it is with your help. The schools are coming along, and somebody mentioned earlier today that we had 200 and some odd schools and are now to 100 and something. Yeah. And I closed, as leader of the board, I closed a lot of them because we went 7 years without NECs, and some schools thought they can get away with stuff. And integrity is the linchpin that we, as educators, as nurses, have to maintain. To do the right thing when we know nobody's watching us. And you've proven that you do have the integrity, just as all the other schools that have come in here. And I want to make sure that we continue that legacy. So thank you for your hard work and effort, and my felicitations on your continued success in this direction.
My promise.
Thank you, sir. On that note, Madam President, I motion that we accept the NEC recommendation as presented.
Second?
There's a motion and a second. Is there any public comment? Seeing none, any further board discussion? Seeing none, it's been moved and seconded to accept the NEC's recommendation. We'll do a roll call vote, starting with Eric.
Yes.
Todd?
Yes.
Andrew?
Yes.
Samantha?
Yes.
Myself is yes. Bernice?
Yes.
John?
Yes.
Donna?
Yes.
John?
Yes.
So motion carried. It was unanimous, and thank you for your time.
Thank you very much.
Okay, there's been a request to take item 29 before agenda item 28 because we have a guest here, Deputy Attorney General Brett Kingsbury. So we're going to take agenda item 29 out of order. So it's the report and recommendation of the Enforcement Committee, which is Andrew Moreno and John Durking.
Thank you, Madam President. If I can draw the board's attention to items 2 and 3, which have been discussed and I think mirror what has been provided previously in the executive officer's report. And I know a particular topic of discussion has been cost recovery. 2 points. One is that when Member Durking and I met at the Enforcement Committee, we had discussed some various options. So one part, to bring that to the full board, to have those discussions, but also we have someone from the Attorney General's office who's going to discuss what are some considerations when taking into account cost recovery. And if you want to add anything else, Mr. Durking.
So I think I'm sorry, were you?
No, go ahead.
Okay, I'm not sure if it might help me to guide what I talk to you guys about, if I have a better idea of what you're thinking about. I'm not sure where you're going with the cost recovery issue. I've seen stuff that suggests maybe some kind of delegation of the AG's office, and so I've thought about some things with that. And the other side I saw was something regarding petitions for reinstatement. Could you direct me?
Right. So in our discussions, it was my thought process that when a petitioner comes before us and this board has considered cost recovery, we are sometimes left with a question of, well, how do we even determine what that will be? What is the mechanism? How can we determine if there's any guidelines, in a sense, to how to get to that number? When I have had the opportunity to communicate with board staff through the Enforcement Committee, for example, when we do stipulated settlements, it seems to me that it was very much based on the financial background of each particular applicant or petitioner based on what they could or could not afford and what's feasible to them, but there was not an exact formula to follow. So my thought process would be, and now we can open it up to other board discussion, is that when a petitioner comes before us, would it be appropriate in their application to request some of their financial information? Their income, any additional sources of income. Of course, we ask for their occupation, if they've been unemployed for how long. Do they have any additional sources of income? What are their monthly expenses, which can be itemized? And I think a lot of that information that I was able to gather comes from one of the California judicial forms, FL 150, the income and expense sheet, which asks those filling out that form some of their background in terms of their finances, and to see if that would be appropriate for the board, and if that's something that we would like to do.
So I think, if I may speak, I think that you're on the right track, but I would modify it a little bit.
Okay.
I think, and I'm not sure how well you guys understand cost recovery as a general concept in terms of, I've heard several people say what kinds of things can be considered with regard to reducing cost recovery. So I think I'm going to give you guys a little primer.
Please.
And so if I'm telling you guys stuff you already know, I'm sorry, but I think it might help just to have everyone on the same page. So in general, we're not entitled to cost recovery, okay?
Right.
That's the thing to remember. And the only time we're entitled to cost recovery is in a very narrow set of cases, which are our accusation cases. So in our statement of issues cases, our citation appeal cases, our petition to revoke probation cases, none of those are we entitled to cost recovery ever. Within, and when you look at accusation cases, there's a footnote, and I can come back to it later. But in general, if you have accusation in the title of the pleading, you're going to be talking about cost recovery, okay, in general. In the accusation cases, cost recovery is not something we're entitled to. We ask for cost recovery when we go to hearing, and an ALJ is the party or the person, the only person who has the legal ability to give the board cost recovery. So set aside what you know about with regard, what I'm going to talk about here for a second with regard to stipulated settlements, and we'll talk about that in a second. Cost recovery, the default position is we go to hearing in every case, right? And so when we go to hearing, at the hearing, we present evidence of how much it costed us to, cost is the word, how much it cost us to prosecute the case up to the point of the hearing, and the ALJ can give us cost recovery. Now, there is a constitutional question about the effect of that process. That process, because it makes cost recovery be greater for those people who exercise their right to utilize the hearing process There's a constitutional question of whether or not that increased cost recovery that occurs when someone says, no, I'm not going to settle, I'm going to take the case to hearing, and then they lose, they end up with much higher cost recovery because they went through the whole process and didn't settle early. So there's a constitutional question. I give you that background just to raise the point, which is there's a case that basically holds that in deciding cost recovery, an ALJ can't just grant all the costs that are requested. They have to consider, in fact, there's 5 separate specific things that they're supposed to consider when deciding whether or not to grant cost recovery or to reduce it. The 5 things basically deal with, well, they're different. I'll just tell you what they are. One is whether or not the respondent utilized the hearing process to obtain dismissal of some of the charges or a reduction in the level of penalty. So let's say, we go to hearing and we argue that the license should be revoked. If the ALJ decides that the license should not be revoked, and in fact, the 4 causes for discipline that you brought, only one of them really stands and you've only proven one, the ALJ is constitutionally required to consider that and possibly reduce cost recovery because of that. So that's the first issue. The second one is whether or not the respondent, in pushing the case all the way to hearing, had a subjective good faith belief in the merits of their position. So it's just subjective. The third issue is whether they've raised a colorable challenge in evidence about the things that you're trying to prosecute them for. So, did they bring in evidence? Did they make it hard? Was it a difficult case? The fourth issue is whether they're financially able to pay whatever the cost recovery is going to be. And so that actually makes it a relevant inquiry in all of our accusation cases, with the footnote that I'll talk about in a minute. In all of our accusation cases, we're allowed to inquire and put in evidence about how wealthy someone is, what kind of job they have, if they are employed, assets, family support, their living situation, all kinds of things. How many cars do you have? What are they worth? All this kind of stuff. So the ALJ is supposed to consider, when deciding cost recovery, whether financially able to pay. And the last one is whether the agency incurred a disproportionate, way bigger than they should have, investigation and costs in order to prove some very minor misconduct. So it's about the proportion of how much it costs to prove the facts and the violations that you've shown. Now, ALJs typically do all of this together. They cite this case, they talk about it, and then they say, I'm going to cut 20% off.
And that's Zuckerman, right, counsel?
That's correct.
And do they consider each item as weighted equally?
There's no guidance on that, and I would say, I can't tell, because in most cases, they talk about all the 5 factors, and they say, having considered all 5 factors, here's what cost recovery is. So, yeah.
A point for clarification, so I understand. So when this board receives an application for reinstatement of licensure and it lists cost recovery, that has already been that's already been adjudicated in a sense by an ALJ, and so that number could have been reduced or not reduced. And what we're getting is more or less something that's already been reviewed. Is that correct?
Depends on the type of case and the manner in which it was adjudicated. So I'm going to talk a little bit more about cost recovery, and then I'm going to come more specifically to your inquiry, which is about the petition process and where cost recovery comes in that. Okay?
Mr. Kingsbury?
Sure.
The Zuckerman versus Chiropractic Board of Examiners, those are the 5 things you talked about?
Yes.
Okay.
And then, so now, let me clarify the footnote. The footnote is I said in all accusation cases, there's actually a very narrow type of case. Those are the 820 cases where you have a psychological exam. You can't get cost recovery for those cases. Final thing is I told you I'd set aside settlement. In settlement, the board is imposing cost recovery as a term of an agreement. There's no boundary on your ability to consider when entering a settlement. There's no legal requirement that you include the cost recovery. There's no legal requirement that you keep it at the top or that you put it at any certain level. What I see in practice is that most agencies consider cost recovery as some place that they can bargain with. You're allowed to agree in a stipulated settlement as a general matter to anything that's not illegal to agree to. And it would be legal to reduce your cost recovery. I've seen cost recovery cut in half. Our agreements for statement of issues cases and petitions to revoke probation cases, we don't have that term because, again, keeping in mind the default, if we went to hearing, we wouldn't be entitled to cost recovery. So no one's going to agree to pay it in a stipulated settlement, and it would be weird to ask for it. So in those cases that are accusation cases that we settle, you can cut it however you want. A lot of agencies are willing to and think strongly about those situations where someone is able to financially suggest or show through documentation that they have financial limitations on their ability to pay. Otherwise, it's just something that can be used as something to bait settlement or, try to increase the chances of settling. All right, now going to the petition process, right? So now you're talking about when you are receiving these petitions for reinstatement. It depends on how the case was adjudicated to know what occurred. If the case that led to the revocation of the license was a default, there's not going to be cost recovery as a general matter. In general, remember, a default, you're not entitled to cost recovery. We have a practice of notating on our default decisions how much costs were, but that's not something that the board is entitled to, okay? Cases that come out of a hearing where an ALJ revokes a license, then you're going to have a cost recovery amount. And in the petition for reinstatement situation, in that situation, if an ALJ ordered cost recovery and the board adopted that cost recovery amount, there's going to be a limitation on your ability to reduce that amount in the reinstatement process. I'll come back to that. The third way a case can come to it is settlement into the petition to reinstatement process. Settlement, you're going to have a cost recovery as well. A lot of our settlements, we include, especially those ending a licensee's time as a licensed person, they're going to have a clause that says, you have to pay this amount before you're reinstated. So the two types of ways you're going to have cost recovery, almost always, on a petition for reinstatement is after a hearing where someone was revoked or after a stipulated settlement where someone was revoked. When it came from a hearing and an ALJ issued an order and the board adopted that order, the cost recovery amount that is ordered, and now the one that you guys get on your petition to reinstatement packet, that amount cannot be reduced. You cannot reduce it in granting the petition for reinstatement. That's true. What you can do is, go ahead.
It only makes it a little confusing because when we've had these discussions, they've been in closed session. So I don't know I don't want to discuss what it has been in closed session, but it just.
Yeah, this is a weird conversation for me to have in an open hearing with you guys.
I guess different.
So as long as you're not discussing
Right,
a specific
yes.
disciplinary case, then you're fine in discussing a general approach.
Okay.
Hold on, let me.
So I have a question. Yeah.
Yes. This is what I
That
do
isn't
for a living.
Zuckerman, is it?
No, but what it is 125.3. And I'll read you the statute, and this is something that is odd because if you guys violate the statute, no one's ever going to sue you about it, but think about it in terms of what you're supposed to do, which is follow these statutes. The statute says, except as provided in paragraph 2, set that aside, the board shall not renew or reinstate the license of any licentiate who has paid or who has failed to pay all of the cost ordered under this section. That's the section you guys get ALJ orders for cost recovery under. When you're reinstating a petitioner, you can't reduce the cost recovery. They need to pay it all off before they get their license. Now, what I said is paragraph 2 is your exception. Your exception in paragraph 2 is very narrow. It doesn't allow you to reduce the cost recovery. What it allows you to do. What it allows you to do is give them a year to pay off their cost recovery, but only if, one, they establish financial need for that, if they establish, I'll give you the wording, if they demonstrate financial hardship and enter into a formal agreement with the board to pay off the full cost recovery within a year, then you can give them a year. But and let me remind again where we're at. We're at where an ALJ issues an order, a cost recovery order, in a decision revoking a license. The board adopts that order. The person then petitions for reinstatement. And while they're coming back for reinstatement, you have that cost recovery figure. They either have to pay the full amount or pay it within 1 year after establishing financial hardship and entering into a formal agreement.
So let me clarify this with you, Mr. Kingsbury.
Yes.
Okay. We get the petition for reinstatement. The license has been revoked previously because we adopted a proposed decision of an ALJ,
Correct.
which included cost recovery of $5,000, say, hypothetically.
All right.
They come to us, they have not paid any of it. We cannot say, because you're, I don't know, for instance, homeless, we're going to eliminate the cost recovery to zero.
Nope.
So you might see confused looks on the faces of the board members because, in fact, this is the first time I've heard this, and in fact, that has not been our practice.
That's okay. And you guys, in closed session, you're going to talk to your attorneys about how you want to handle it, but I'm just trying to give you the information as I understand it. And whatever I'm telling you, if your attorneys tell you differently, they have veto. But what I'll tell you is my understanding of what this statute requires is that you either have to pay the cost recovery in full in that situation, in that series of situations that I've talked about, board, ALJ. It has to be an ALJ order, and it has to be adopted by the board. And then they're coming back for a petition. They either have to pay that full amount or pay it within 1 year after demonstrating financial hardship.
The full amount.
Yeah, I mean, basically, if you can think about it, this is the legislature's way of saying, you know, you don't get out of cost recovery just by taking some time off.
So then wouldn't I'm just going to start talking. Because in this particular situation, we have a judge in closed session with us, and we have been known to historically reduce or completely do away with cost recovery. At least we thought we were. So what's happening with all of those cases?
Well, I mean, so look, I litigate for a living, and so I tell people to follow the law, and when things look vague or in any way questionable, I go, you know, who's going to sue? And when you get to that inquiry here, there's no one who's going to be complaining about it.
It'd
be the district attorney who would have to sue us.
So reading between the lines there?
No, because you wouldn't be committing a crime.
Oh, okay, we wouldn't be committing a crime. Oh, okay.
We're not committing so if I understand correctly, we're not committing a crime by reducing their cost recovery, but as you previously stated, we're not
Well, now you
following-
might be. Now that I've thrown the wrench into it, I don't want to say anymore.
We're not following the statutes, which we are supposed to follow.
The statute seems pretty clear to me in that regard. There's some other areas where it's less clear. And I don't know if it makes sense for me to talk more with your attorneys about this, and then they can advise you in closed session. I don't want to limit your options in any way.
Let's do that.
So is it on so, I just have one more question. Would it be on the judge that's in closed session with us to have informed us that?
No, I mean, this is if it would not at all be surprising that someone wouldn't know the details of this unless if they dealt with this specific issue before.
Okay, thank you.
Todd, do you still
What?
have a
Go ahead.
question?
How does that, what you said about not being able to reduce, our ability to modify terms of probation? Because if
So you're
cost
talking on the
recovery
front
was a
end.
term of probation, don't we as a board have the ability to modify?
On the front end.
Okay.
Yeah. So basically, and what you mean is if they, in resetting the term of probation, could you change the cost recovery? I'm not.
Okay, let me ask it this way. Somebody comes before us for reinstatement. They make a strong case, but we're going to place their license on probation. We can modify the terms of probation so that the public can be protected. They can be a safe practitioner. Everybody's rights are protected. Everybody's kept safe. We still have that ability to modify. terms
Yeah.
of probation.
All we're talking about is cost right now.
What's one
Is
of
that
the
what you mean?
terms?
And that would be a term of probation.
Right.
Paying it off,
Yeah.
within, say, a term of probation is 3 years. My understanding is they have 3 years to make an agreement to pay it off at whatever amount the board agrees to. And if for some reason they can't during that term of probation, that 3 years that was set, they can have an additional year, which is kind of what I thought you were talking about.
So, but I think you're, so this is in a petition for reinstatement?
Yes.
Okay, so in a petition for reinstatement, it's different. You're subject to this extra rule, right? The thing that I've seen is in these probation orders with the cost recovery. Elsewhere, yes, that works. In the petition for reinstatement, you have this statute that kind of mucks everything up. I shouldn't have raised it. I mean, but you did ask me to talk about this.
So I have a question. So in a traditional, if we obtain cost recovery, normal amount, how does that go back to your office? Where does that money go? Do you know?
To you in some way or another that I don't fully understand.
I don't fully understand either. I've been on this board for, okay. And then, I think I'll wait. I won't ask my.
What I was going to add is remember, this is only where an ALJ issues the proposed decision, which is adopted. So you have your stipulated settlement, which raises a whole other area of types of cases that come to you with cost recovery, where this specific narrow rule doesn't seem to apply to me, but you can talk to your attorney about that, your DCA counsel. What I would say, though, is to get back to this original point, which is is having that background or understanding more about the cost recovery thing. You have a petition for reinstatement. They have cost recovery outstanding. I don't think it makes a lot of sense, and I'm not advising you because I'm obviously in a public scenario, but I'm going to talk about what makes sense to me. I don't think it makes sense for you to request a bunch of financial information from every petitioner that comes to you. I don't think it makes sense at that step. When it comes to, because at that time, if you think about it from the person who's seeking their revoked license, or they're trying to reinstate, they don't have a lot of incentive to pay off that cost recovery if they don't know whether or not you're going to let them be a licensee again, right? Because at that time, they have this cost recovery, and it's not pressing. They are going to wait, I would assume, until the point when they have an order that says, yes, you can be a licensee again if you pay the cost recovery. And so I don't think you want to solicit information financially, and I don't think it's probably a lot of stuff you guys don't want in your possession, that information, unless you need it. And so I don't think in the front end you want to be asking that of every petitioner. Now, once you get to the point where you're issuing a decision, and that decision is in the context of an ALJ-issued order that was adopted, and there's an outstanding cost recovery, at that point, you're gonna probably make sense to include in the order at that point something that says either pay off this, just like you do when you have the NCLEX test, that when you have an old a petitioner who had an old license and they need to retake the test, you condition the reissuance of the license based on their passing the test and fulfilling all the requirements of licensure. Makes a lot more sense from my perspective to include at the same time, and you have this cost recovery outstanding, you need to either pay it before reissuance or demonstrate financial hardship and enter into a formal agreement with the board to pay it. At that time, if they want to enter into that second round, so you've given the condition, either pay it or demonstrate financial hardship and enter a formal agreement. At that time, if they say, I need a year to pay this, or I need more time, then solicit the information at that time.
Okay.
That's my take. Anything else?
Didn't realize that we've been going about it all wrong.
Well, it's, honestly.
I wouldn't say that. I wouldn't say it was wrong.
No, yeah, I mean, I don't know that you have been going about it all wrong.
I don't have any questions, but I appreciate the primer and the clarification that you provided today.
Okay. Thank you. Anything else that I can be of assistance with? There was some talk of a delegation to the AG's office. I don't know if you still wanted to talk about that.
I think the issue in my discussion with the San Diego AG's office was that some amount of cost recovery, if there's an indication of a fair amount of investigation costs associated with the matter, that the delegation of some authority could facilitate resolution of the matter. Is that also your understanding? Have you handled that in practice?
Yeah, I'm confused as to what they mean by delegation of authority. This is something that's handled on an everyday basis by your staff.
Right.
They do, now maybe if you want to think about delegating authority to reduce the cost recovery and settlements, but I think they already have that authority. And so what happens is we're talking, constantly settlement negotiations with other attorneys, and they ask for a cost recovery. We just send an email to our client, which is, your staff member, the analyst on the case. And the analyst checks with whoever the powers are and says, we're willing to not, or we're not going to do that, or we will offer, whatever reduction.
Yeah, my concern was that the board and staff and the AG's office are all on the same page with respect to the cost recovery element.
And so I thought they were, but it sounds like maybe there was some confusion.
Well, my understanding is that some boards have delegated authority to the AG's office for some pro rata or set amount, expressed as a percentage of what would otherwise, it could be ordered as cost recovery should the matter go to a hearing before an ALJ, versus the matter being handled on a case-by-case basis, which is what I just heard you expressed with our office.
Okay, so what I would say is I'm unaware of any such delegation in any of the clients that I work with. And that I would not, this is again an odd situation to discuss in public forum, but I would not recommend doing that. In fact, particularly because any such delegation would be a publicly available, or I would assume it would be an available thing, Public Records Act request. And if you have a general delegation like that, you're not talking about a specific case. I don't know this part, but my assumption would be that that would be something that would quickly get out. And then every single person we're in litigation against expects that. The other thing I was thinking about with regard to this, because I was trying to figure out what you guys wanted to talk about exactly or what you were concerned about, is that one of the big reasons you hire an attorney to litigate for you is this whole agency theory of negotiation. To be quite fair, or to be very clear, what happens is when you're negotiating something and you have the client, you're in an advantage because the person who is doing the negotiation is provided the opportunity to say, sorry, man, my client's not willing to do that. I get it. I know what you mean, but, we can't do it. Whereas if it's me and they know that I have the authority, I can't be the person bringing the bad news, but not the person who's doing the bad news making. So I wouldn't push in that direction, or I don't like that direction personally. I think a lot of what you get when you hire an attorney is the ability to be in the background, and that second step between the two parties that are actually with interest in the case. I'm happy to keep talking. I feel like I've maybe.
So,
Oh, no.
a cost recovery authority for this board would primarily extend to those matters that have not yet been adopted by the board. The statute under the Business and Professions Code is otherwise clear that where this board has adopted an ALJ decision, then we are, under the code, bound by the terms of the cost recovery element that the ALJ has already ordered, correct?
I think, yeah, in general. I think you're in general correct. What I wanted to add is there's a couple of things, a couple of possibilities in that respect. But I can remind you of one thing, which is that whenever you get ALJ decisions in the first instance, you guys are always entitled at that time to reduce cost recovery before it becomes a final decision.
Right.
You can always do it on the front end.
And that's
so-
also clear from the code.
Yeah, there's no doubt that you can
25.3D.
reduce. I'm sorry,
Right.
go ahead.
No, that's right.
Yeah, there's no doubt about reducing it. You don't have to reject the proposed decision. You can just reduce and adopt. That's always available. The question is then, and in these cases where the ALJ has issued an order and it's been adopted, whether you can then thereafter basically cut. And I'm, like I said, I'm happy to talk to your attorneys more, and we can discuss further, and maybe in terms of what they advise you to do could be different than what you're concerned it might be right now listening to me.
Maybe then what I would propose is that you could speak with our counsel, and then perhaps at our next enforcement committee meeting, that could be a topic of discussion, and then bring that back to the full board of what that conversation was. If that sounds reasonable.
It might have to be a closed session discussion. It might be closed session for legal advice.
I mean, I can.
We can make ourselves available as needed
I can
to
talk
discuss
to
these
you.
issues.
I can talk to you,
Sure,
and we can, and then you can
Advise the
do
board.
whatever you
Yeah,
think is
exactly.
appropriate. Okay. All right. Anything else? I'm happy while I'm here.
Thank you.
Thank
All right.
you.
Thank you.
Very educational.
Very much so. So, very interesting. So that brings us back to agenda item 28, report and recommendations of the Education Committee.
Yes, Madam President. I hope everyone has had a chance to review the packet from the Education Committee meeting held on January 26, 2017. Because we have two items we'd like to talk about, I want to first draw your attention to the very last two pages, which in essence will be 28B, and then we'll return to the issue around the school. Those last two pages include a statement from the EO and asks about the possible action regarding curriculum content for vocational nursing and psychiatric technician programs. And according to the code in sections 2841.1 and 4501.1, we as a board are mandated to protect the consumers, but as part of that duty, from time to time, we should ask for a review and, if necessary, an update of the curriculum used in the preparation of said professionals. This was addressed or included as an item at the committee meeting. It was an item for discussion. And as a result, there was a big recommendation that members of the public, in essence, those individuals who work at our schools, who are part of the schools under our sanction, be engaged in dialogue around the current curriculum, as well as items or changes that might need to be addressed or updated. A little bit of context, realizing this is a profession that will be in growing demand in the future. And according to data, particularly the California Employment Development Department and U.S. Department of Labor, that by 2024, the demand for said professionals, particularly LVN, will increase because of changes in the demographic in our population, particularly aging population. Taking that into consideration, what should we be doing differently, if anything, in our programs to prepare professionals, to make them ready for the changed populace? And I want to put that before, we as a committee wish to put that before the board. And we'd like to ask, with staff's help, to arrange opportunities for public input from programs, directors, and others to gather information that would be used in such consideration. Because no one knows better than those who are preparing LVNs and PTs.
Tammy, I have a question.
And in this discussion, we're asking for a little feedback from our board colleagues. It is our recommendation that there be formalized sessions.
Madam President,
Yes.
I just have a question actually for Ms. Anderson. I think it's great. I think the committee did good work. About the VN and PT exam outlines, I'm wondering for the NCLEX, the VN test, do we have any ability to even influence that because it's a national test?
Yes, we do have
Okay.
the ability to influence it in that our licensees are also surveyed,
Okay.
just as we do with PT.
Sure. And then the analysis of a professional practice, I know it seems like it was recent, but maybe time got by me, of PT occupational analysis and a new test plan that started in 2016.
Correct.
So we could still do another one? I mean, it's,
I'm not sure we would need to do another one at this point, but it's possible. But the information that we gathered from the PT test plan,
Great.
our occupational analysis, would certainly be useful here. We also have access to National Council, the one that was done by the National Council of State Boards of Nursing.
thank you.
Any further discussion by board? Donna?
So, I see your recommendation, so, two questions. One, who are you recommending take on these recommendations? And the second thing, are you reaching out to the state? Because I know that there's a state, and I don't know their names, but I know that there's a group of people that are looking at forecasting about the change in the nursing environment and the change to what LVNs are doing now and what they're going to be doing later, and changes in the titles and everything else. So are you integrating with that body? Or would you need to integrate with that body?
At this point, we do not have an answer for that. These 2 pages we make reference to came to the committee from the EO. And in response to this particular document, we opened it up for input discussion from those who were present at the most recent committee meeting. And given that the recommendation on page 2 was to complete the analysis of the following A through J by November of 2017, as a committee, we strongly believe it's important to ensure input from those who deliver the services and prepare LVNs and PTs. And part of this does reflect future forecasts.
Okay. So is it the Education Committee that is going to complete this analysis? Because at the number 2, it says schedule a presentation of the report to the Education Committee.
Correct.
So is it the Education Committee that's going to do the analysis?
We asked that question, and as an education committee, we are recommending that, one, if the board would endorse the gathering of this kind of information, that we would need to seek board staff support to make it happen in a formalized way.
I think,
But the report would come back to the Education Committee, and they would
Which is
present it to the
item
board.
2, the very last piece, scheduled presentation of a report to the Education Committee by January 2018.
That's why I was asking, because if the Education Committee is gathering the data, then they wouldn't need to report to themselves.
Well, no.
So it's not really the Education Committee that's
Correct.
going to be gathering the data. It's going to be the board staff, which is going to gather this data
Correct.
and then present it to the Education Committee.
For our action, and we most likely, well, we will be, after reviewing it, bringing it back to this body at a later meeting in 2018.
And has there been discussion about board staff being able to take this, having the bandwidth to take this on?
Yes,
Ms.
if-
Anderson,
if
would
you
you-
notice, we're saying it would take a year to do this. This is not something that would be a rush job. We are anticipating a year. It may take longer, but by November of 2017, we would be able to give you a status report so you could see exactly what we're finding, and then you tell us where you want us to go.
All right, and are you integrating with the Division of Labor? I'm sorry, I can't remember the name. I sat on a call with this.
We are not integrating with the Division of Labor. We do have information from not only the U.S. Bureau of Labor Statistics, but also the California Employment Development Corporation, as well as a number of other sources of data that we've been looking at in terms of what the projections are. And as Dr. Baz de Martinez has said, there is a projection of a 16% increased need for licensees through 2024. It's not quite as large for psychiatric technicians, but there's some other changes that are occurring, so that the projection is that that need will increase beyond the 1 to 5% that it's currently projected. So those are the kinds of things that we're looking at. And then why, and then what are the implications for licensees? What are the implications for the board? What are the implications for our regs? Are our regulations consistent with where we need to go? You know, we talked about curriculum. Do we have, do the minimum required curricular areas cover what will be needed for future licensees? It's that kind of study.
It's a very worthwhile project.
John?
I also wanted to point out stakeholder buy-in. Not only are the schools going to be affected, but the job providers,
That's
the
correct.
employers. And so one of the reasons why it's going to take as long as we suspect is do the outreach to who's going to employ all these LVNs are coming of age, or LVNs are coming out of school, and then talking to the schools about what are they seeing in their clinicals, what are they seeing in their communities, and get their input. Because without, we can make all the changes we want, but if the people who don't have a stake in the matter aren't given time to give their feedback and their input, one, we don't get the buy-in because we need their cooperation, and two, we may have a bunch of LVNs that are unemployable because they don't meet the market needs of the future. So that's the other thing that's going to take some time, is getting the input from all the stakeholders, the schools and the employers, to find out what do you need.
Yeah, the other thing that's important for the board to remember is that the division does an annual survey of facilities in terms of utilization of licenses and what are you seeing and what kinds of changes you're projecting and that kind of thing. That's information that we need to factor in. Likewise, on Wednesday, this was our first time that we met with facility representatives and schools to clarify the roles of VNs and PTs and how they're being utilized and any other questions that they may have. It is anticipated we will schedule more meetings across the state. This was our first one here, and from what I understand, the room was full. We had a maximum capacity of 65, and I believe it was full. And everything that I've heard that was a very positive occurrence. So we will be scheduling more of those.
If I may add, one item continually came up in the brief time we had for discussion. There is a real need to help future LVNs, as well as PTs, become tech savvy. And it's not just about turning on a computer, but because technology is starting to play such a critical role in patient care and the delivery of services, anyone who does not understand how to engage in that kind of environment will not, potentially might not be as employable as others who are.
Digital fluency.
That has come out.
Exactly.
To help us move on, because it's becoming an action item, we move that the gathering of such data by using board staff be advanced, and that an initial report of the analysis be presented to the Education Committee by January 2018.
I'll second.
Just as a procedural point, I don't know if we need a second since it's a committee report. Maybe the chair can rule on that.
If we do, I'll second. If we don't.
You're correct. You're correct. It's coming from 2 board members as a committee. This is a seconded motion effectively.
So, thank you. We want to move on to our other item.
Well, it still is a motion on the floor, which means you would ask for public comment and then call for a board vote.
So there's a motion and a second on the recommendations from the Education Committee in regards to move to gather data by using the board staff to advance and present to the Education Committee by January 2018. Is there any public comment on that? Seeing none, do any further discussion by board members?
This is for 28B.
28B.
Correct.
I just have one comment or suggestion, maybe the Education Committee could take under consideration. While, of course, we'll be having board staff we'll use board staff to do this, we also have many stakeholders and professional associations and other sources of information that could help us. So I would consider partnering with those resources as well.
Any other discussion from board members? Seeing none, we'll do a roll call vote. It's been seconded and moved. So on the recommendations from the Education Committee to gather data by using board staff and presented to Education Committee by January 2018, we'll do a roll call vote. Eric?
Yes.
Todd?
Yes?
Andrew?
Yes.
Samantha?
Yes?
Myself is yes. Bernice?
Yes?
John?
Yes.
Donna?
Yes.
John Durking?
Yes.
So motion carried, and that was unanimous. And 28A from the Education Committee?
Okay, returning to our report, under consideration and for possible action to make recommendations. We're making recommendations to the board based on our review and interactions with, and I think the name is not accurate on our agenda, with the Medical Allied Career Center Vocational Nursing Program.
Correct.
And as the result of our interaction with the representatives present, we are recommending acceptance of the report. It was noted that there have been some infractions. A representative was cautioned on admitting a class before or without board approval, that is unacceptable. It was understood as a result of our interaction that the school is very much aware, and that should not happen in the future. They were commended on their licensure exam passage. It has improved, and we'd like for them to be able to move forward. We have a first and second, and a motion to accept the report.
Okay, there is a motion on the floor.
It doesn't require a second, does it?
No.
Okay. There's a motion on the floor. Is there any public comment on this? Seeing none, any further discussion from board members? Seeing none, the motion was the committee moved to accept and recommend the board adopt the report with the recommendations.
This would to effectively put this particular program on provisional approval.
Yes,
Do we not want to hear from the school?
is there a representative?
Is there a representative from Medical Allied Career Center? Okay. If you could state your name for us and your title?
Yes, I'm Liz Gerber. I'm the Assistant Director, and I was at the Educational Committee last month. And I'm agreeing that we did mess up in 2012. My director was not aware that he needed to ask for an approval, and he's no longer with us. And there was a class in 2014 that we did get an approval for a full-time. We didn't have enough students for that. We converted that to a part-time class. That full-time class was rescinded a month later, and that was back in 2014. Now, last December, with Ms. Gomez and Dr. Alfie, she had asked if we had started batch 11. We have not started the batch 11. We brought the class in to let them know we did not have an approval. That class we conducted, giving them a prep class, teaching them drug calculation, math, conversion, and basic medical terminology. So batch 11 started January 31st. They said that wasn't approved to start, and I confirmed with Ms. Gomez. So I'm asking, we've had a, good pass rate. We've had 2 classes that we acknowledge now, but we're not going to start a class that wasn't authorized. And you're putting us in a provisional status. We've been in business for 10 years, and we had 2 unauthorized, so.
Okay. Samantha?
I have a couple questions. I was looking at the history of this school. I'm not sure if it's for, I don't know who the NEC was on this one, Ms. Gomez, or it's for the Education Committee, so I'll just put it out there. I feel like this school recently came off of provisional, no?
Yeah, we got up in 2013, 14, I'm not sure.
2014, right?
Yeah.
And then, they recently come off provisional. I'm looking at the program average annual pass rate, 94, 93, 89, 90, 90, 71, 73, until we go back to 2015 where it's below. So that's 1, 2, 3, 4, 5, 6, 7 quarters of good average state pass rate. I think in your report, Ms. Gomez, it says they have adequate teachers and placements. So the sole reason that we're putting them back on provisional is because of the unapproved classes? Yes. But they never started the unapproved classes?
When I called and talked to the director, when I called and talked to the director, I told him that I needed a new date. He told me he could not give me a new date. I said, well, you know, you can't start the class without approval. And he says, oh, we've already started it, and that was his word. And then he said, I talked to Miss Anderson, and she said everything was okay. After that, I said, but you know you can't start a class without approval. And there was a long pause. And then he said, well, they're just pre-class things. And after we took the report to the executive officer, I called him back after to let him know that we were going to take it to the education committee. He says, well, no, well, I got the okay from Beth DeYoung, who's our new NEC, and she said that we could start it. I have an email from Beth DeYoung stating that he was not starting the class. And so everything that I got from him made it look very strongly believe that he had started the class.
Ma'am, we did not. We brought the students to let them know we have no approval for batch 11. We brought them in, made them aware, but we gave them a prep class. The curriculum was not started until January 31st. So there was no unauthorized class started, not until January 31st, after I conferred with you last month. And the only two is 2012, 2014. We're in 2017 for this one class, and we did not start a class.
So, I mean, putting someone back on provisional is a serious thing. I don't know how we could find, I mean, I don't know if we could even today find out, was the classes approved or, did they actually start or not? Because if they didn't start unapproved classes and we're putting them on provisional for that, I don't know. I don't know if there's a way to find that out today, I guess not. Okay.
All I can go with is what he said and the way he was talking to me.
Okay.
And that he told me that he had gotten the okay from Miss Anderson.
And he did not. He did not get any okay from me.
And then after the report, then he said he had gotten the okay from Miss DeYoung. So he had told me twice, in two different situations, that he had gotten the okay to start. But I got an email from Miss DeYoung stating that he was not to start the class. And when I was talking to him, it was like he was searching for, and I mean, there was a really long pause before he said that they were good classes.
For our colleagues, at the committee meeting, we only had the information that is before you. The school was present. We understood at the committee meeting that that would not happen again in the future.
No.
However, this recommendation is before you based upon the information that we had January 26, 2017.
So just so I can be so I can fully understand. This school was not on provisional status. And- So if they're not on provisional status, why do they still have to request approval to have students?
That's kind of typical. That's kind of typical for schools that do not have permission for ongoing classes, that if they don't have that permission, they have to request a class start each time. It's not a punishment, it's not punitive, it's just so that we know what the school has going on at any particular time. But schools with a good good reputation of pass rates and compliance may request and receive permission for ongoing classes, but they're set usually on a schedule of one a quarter or one every 4 months, where they have a consistent schedule so the board can predict class starts, graduation dates, pretty much, and class size.
John, I'm not sure that was Donna's question. I think,
Well, it kind of answers the question. So they're not on provisional, but it's customary that the schools still have to request through but not by the full board, just by requesting. So how do they request students?
They submit the paperwork, and we've delegated to the EO for permission for starts.
Okay.
And that's actually in her report, when she did the report for schools have requested and were granted permission for class starts.
Unless they have an ongoing good reputation and they have a permission to start classes without having to ask. Did this school know that they did not have that?
Yes.
One other point that needs to be made is it's not just, well, why do they have to do it? Regulation, California Code of Regulations, Section 2530K says, the program shall have prior board approval to increase the number of students per class and/or increase the frequency of admissions of classes, so that they do have to come before the board. The other thing that I would just remind the board, and Ms. Gerber and I have discussed this before, this is not the first time this program did something very similar. There was another instance that occurred during the time the program, we were trying to get the program off of initial provisional approval, and that was in 2014. So that this school was aware of it, or the director, I'm not saying Mrs. Gerber, but I know the director was aware. This is the second time, and so that's why it comes back to you. When programs are, when you approve programs for a 4-year period, you will also state to them that they are required to comply with all requirements specified in California Code of Regulations. And in this case, the school did not. And so that's why the action occurred.
Additionally, if you will look at the packet, there was a change in the type of class that would be brought in.
I'll move to accept the report.
The motion's already on the floor, and it's been seconded.
Any further public comment? Just the vote. And then just the vote? So it's been moved in second to accept the motion to accept and recommend the board adopt the report recommendation from the Education Committee. So we're going to take a vote. Eric?
yes.
Todd?
Yes.
Andrew?
Yes.
Samantha?
I have to say no.
Yes. Bernice?
Yes.
John?
Yes.
Donna?
Yes?
John?
Yes.
So it's 8 in the affirmative and 1 in the no. Motion carried. Thank you. That takes us to agenda item 30, report and recommendation of the Legislative and Regulations Committee. That is Mr. Todd DeBronstein and John Durking.
All right, I'll start, and John, if you want to just fill in, carry on.
Sure.
Okay, 30A is the discussion of the role and possible role of the Legislative Committee and the regulations that will be our guidelines. So I want to give you a second to review, and then we want to put that forward for approval.
So I have a question, Todd.
Yeah.
So in reading your, what the role of the Legislative and Regulations Committee is, can you explain or speak a little bit about your intent with the utilization and practice? Because that seems like it might be scope related, and we have a scope committee. Or is that,
Where are you at on that page? Just,
third bullet down on the first page?
okay, gotcha. So utilization and practice related to the practice of the LVNs and the psychiatric technicians. There's a current piece of legislation that this kind of falls under related to LVNs doing tube feedings in a community setting or in a home setting. So where that piece of legislation falls under the legislative body, yes, it'll get seen here with us, but also in the other committee.
We'll get passed off?
Possible in, practice,
Okay.
yeah.
So because there's like, I can see overlap here with the Education Committee also. So the focus of this committee is, as things come through the legislature and regulations, that this committee would look at them and then reach out to the other committees?
Right, and kind of in the opposite way too, where if there was a new form that we needed to get
Signed?
legislative support for, that came out of another committee, they would give it to us to help with that action.
Okay, thank you.
Makes sense, okay.
So,
No. I know there was, a couple months ago, there was something that came forward, and it first came to executive committee of Andrew and I and Dr. Brown, and then we said, hey, maybe this is ledge because it involved an actual piece of legislation, and then we passed it to that sort of thing.
Yeah.
So we'd vet it to see who would fit best, right?
So I have some concerns about the committee is authorized by the board to act on legislation and regulations between scheduled board meetings. Such action must be reported to and ratified by the full board at the next scheduled board meeting. I feel like that's a bit awkward, especially if it's a political issue, something where it could be controversial. I'm not sure a committee of two, that's the best way to go about it. I know I don't usually see controversial legislation being rushed for a committee, for a board like this. It's a slow-moving process. There are no surprises. I don't mind there being a recommendation made to the full board, but I'm not sure I'm comfortable delegating full authority to draft a letter and issue it without the board members seeing it first. It's almost like a blank check.
How would you like to clean it up? Just delete that?
Yeah, so you see it I think we're just saying the committee is authorized to make recommendations to the board to act on legislation. That's all. But not have the autonomous authority of two. And I think the board is the board should weigh in on these. And I can't think of any kind of legislation that we've made a comment on that would have been, we would have been unable to make that comment due to timeliness.
Just a question for both of you. I know sometimes at the end of the
Both of who,
legislative.
sorry?
Huh?
Both of who? Okay.
And Deerking, and both ends of the table. I know sometimes, I'm wondering your perspective, I know sometimes at the end of a legislative session, things get rushed through very quickly. Do you think that might be a consideration, or that still would be not?
I don't see anything being snuck in about us, I mean, about LVN or PT issues. Typically, those kind of sneaky things are done for earmarking, special interests, things like that, which we wouldn't even learn about at all, right? And so these, most regulations that are being proposed, as far as I know, are being vetted, go through the process, and I would prefer that the board see it, and especially the language and the nuances to it. I think it's really important that the board see it.
Well, I think, if I may respond briefly, Mr. Ma is absolutely correct. The normal process and procedure would be for any matters that come before the legislative committee to then be brought before the full board for consideration. I think what was originally intended here were those situations that happen at the end of a legislative session where we must act, and of course we would do so in concert with the executive committee.
I'm not sure you could do it with the executive committee, though. I mean, yeah. But I do think there are mechanisms we have in place to call a special meeting if it's something urgent, even an emergency meeting, so it's even less than 10 days. So I feel like we have tools at our fingertips, if necessary, for those rare outlier conditions.
Okay. The other piece was, I think, and that's in the next paragraph, where there is testimony needed on a bill, and there isn't the ability to wait for a meeting, but then I think that's covered in the next paragraph that you may also have questions on.
I have concerns that, again, the language that really turns it over to one or two people, and we don't see this often. Again, whenever there's testimony needed, we're given plenty of advance notice, whether it's be the sunset review or legislation that affects our licensees or schools. Like, these are not hot button, let's rush it through kinds of things. I just can't think of one. And I follow I follow legislation, sadly, on my free time, but I can't think of one where we would have needed something like this. No, it's pathetic. It's okay, but.
Do you want to?
So may I suggest that we just remove the language that that delegates action independent of the board? So I mean, we could just say, if you want some line item suggestions, the committee is authorized, so now I'm in the middle of that paragraph, it starts after the completion. The committee, so it already says, the committee is authorized to recommend to the board a position of support, oppose, or watch. And then I think you can just delete, or just eliminate the next two sentences and do a similar kind of thing, where less is more here, from my point of view, that, so you delete those two sentences, and, let's see.
All right, which two specifically?
It
The committee
reads-
is also
Yeah,
authorized?
the committee is also authorized by the board to act on legislation and regulations between scheduled board meetings. Such action must be reported and ratified by the full board at the next scheduled board meeting.
So we won't tell you then, Eric?
And then change the next paragraph. It just says, the executive officer or designee shall consult with committee members to obtain direction and recommend a position to the board.
If I may, and just inject something before we keep going on.
Yeah.
There was a piece of legislation that got passed last year that directly affected the board. AB, and forgive me, I don't recall the exact number, but the bill that directly affected the board based on the qualifications for the executive officer. The one that removed the requirement that the executive officer be a RN, LVN, or psychiatric technician, was actually moved and passed while this done between meetings.
That's the one we were requesting, right, John?
To remove that requirement?
Yes. We wanted that flexibility. The board did actually vote on that.
Yeah, there was
Yeah, I
a
remember
discussion
hearing
on
a
it
lot of
at
comments.
one of the board meetings.
That's a good example of my point.
Yeah.
So if we go back to why we have committees, right? So we have committees. If we go back to why we have committees so that we can have input and things can move along, right? And then it's easier for two people to stay in touch, and we can touch a lot of different things. So the purpose of the committee is so that, in this committee, they would follow the legislative and regulations that are coming out and report to us, hey, you better watch this one because it has an impact. The education committee goes, hey, these schools, blah, blah, has an impact. I don't know that it was, that it was ever the intent to give authorization for two people to make a decision for an entire board.
Yeah, I agree. But the way this reads, that's exactly what it does. The way this reads, it says the committee is authorized to act on legislation and regulations between scheduled board meetings.
So then I'd like to hear from John and Todd about, you have obviously put language in there like that for a reason. So can you give us the reasoning behind the language? Because I don't want to strike language that there is a reason for.
In part where the board takes a position on a bill, and then through the amendment process, that bill takes on a new life of its own. And an expression is needed by this board to be able to do that. Yeah, when it happens, is it very often? I think I think there's a lot of safety in removing the couple of sentences. I'm not sure that it's going to come back to bite us, whether the language is here or not. I think we have.
So would it be helpful if we had language in here that said, in the event that the full board has taken a position on something, that then the committee could move on it? Was that the reasoning why you wanted that language in there?
I can't speak to the reasoning, but in that example, that's precisely a situation where the board has delegated its authority. And you spoke to the purpose of committees. It is true that it's to help allow for a little agility, but one of the fundamental principles of administrative law is that an agency can't delegate away its authority to act. And so I see there's this kind of piece about ratifying, but there's a strong argument that that's basically delegating away the body's authority. So it would be one thing if, in your last scenario, if the board had taken a position and the board was already given that direction to whomever to go put that forth, that would be different already.
Tim, so what if there was something that was being pushed through, which we know can happen, that did affect PTs, and it was a hot button item, and we needed to act on it very quickly, and this language was taken out? Would the solution be to then call a special meeting?
I think that's one option. I also think that the president can in a last-minute situation, yeah, I think the president is entitled to speak and make clear that, you know, this hasn't been reviewed by the board, and, you know, I would hope the president, if it were controversial, would ask for a delay so that the board could get input and, you know, provide feedback. That's what I would hope.
Because I hear the argument. I also don't want to unnecessarily limit our Ledge Committee, because I think they're doing really important work, and it's vital that we're out there in the legislature, meeting with legislators, meeting with associations, and that the governing body, the House and the Senate, hear directly from this board and not just from agencies we're associated with. I think we need our voice heard personally, and I do appreciate the work that they've been doing. So if Duking and DeBrownstein feel comfortable with that, I just like your opinion on that, taking that language out.
I have a question related to that, and I'm not quite sure of the answer. It is true that things can move rapidly or slowly through the legislature. If our legislative committee members see something is happening that this board needs to know about, are there any tools that can be used? For example, we get a regular newsletter from the executive officer. Are there ways in which the legislative committee could give the board regular updates outside of meeting times for informational purposes? I think that's a gray area.
Sorry.
Someone enlighten us?
Well, I will say that, you know, Mr. Dierking and I, as legislative appointees, have a conduit to the Senate and Assembly respectively. So I will tell the Speaker's office, for example, if there's something that is concerning, and I'm the Speaker's appointment, so I can do that. But again, I can't think of any one piece of a legislation that was rushed or snuck in, and like the ones you hear in the news that, you know, people are really upset about. I can't think of one, whether it be like the veterans, you know, who want to go to the fairs to do their, you know, those take time and gives us, and I can appreciate what the legislative committee does. I want the legislative committee to go into the nitty gritty, to do that work on our behalf, to bring it back to us, and then the board could say, hey, we want to draft a letter in support of this. Could the legislative committee do this and then bring it back to us? I mean, I'm very comfortable with that, but like I said, just the broadness of the language is what makes me uncomfortable.
Todd,
And
you have something to say?
I was going to say, do we want to address the second part, but did you want to address the ability of the executive committee to, or the president to act in the in-between times? Because I think, you know, if the legislative committee is communicating to you, then we're kind of bordering on, you know, the inappropriate also.
That's the Bagley-Keene Open Meetings
Right.
Act. That's bordering on that. But the question would be, if there's legislation, and normally they're set for hearing, therefore, we would know the dates ahead of time so that we can prospectively call a emergency meeting or a phone conference and post it for notice, if need be, ideally. Or am I wrong?
I'm just not a big fan of the emergency meeting,
But,
you know.
But just, again, the practicality. We have not had an instance of this. And I mean, so looking at the last part of this, I think it's perfectly reasonable for the next paragraph to say, And it says this already, if proposed legislation or regulation is progressing expeditiously, the executive officer or designee shall consult. I mean, again, I just don't, that's so vague what that means. I don't think you need this section. I think you can just end it there. But if you really want more words, you can read, shall consult with committee members to obtain direction and to make a recommendation to the board. That direction may include drafting letters of support or opposition for the board, and then that's it. But again, the provision of testimony, that's usually reserved for the president, to me, unless the president wants to delegate that authority. And again, discussions with legislators or staff, I think the board has to agree on a position before we know how to engage it. And I would hate to mean that I was, as the speaker's appointee, or I couldn't speak to the speaker's office. That would be awkward.
John, do you have any comments on that?
The intent was to enable a representative of this board to act in between meetings, that's all, on two things. One, those matters moving expeditiously through the committees, which would be an exigent circumstance. And then the other would be where the board has taken up a position, one way or the other, so we can communicate that to the legislators. And again, I mean, the contingent events contemplated may or may never happen, but I mean, it's possible. It just allows us some flexibility and agility in making our position known.
Yeah, I think, and part of my concern is if we're late to the table and we wind up being the dinner. I mean, I don't want to, have some piece that we weren't able to address as a board. But then how, as a board member or as a committee, can I speak for the whole board on the other hand?
That's right.
So
That's exactly right. Yeah. That's exactly. I mean, I would even go so far that I would argue this language is not allowable. I mean, I don't need to push it, but we're a board for a reason, right? And to me, the committee work is to do the in the weeds, so we don't have to take the time in the meeting. So.
If it helps at all, just for background or context, the role of the legislative committee that you've had standing for a number of years, including your submission, it looks like in your 2007 sunset and possibly later, that is a 2-paragraph description that you seem to have, I know for a while your committees weren't necessarily operating, but this seems to be the standing description that existed at that time. If that would be helpful, I could read it, or it's a 2-paragraph description.
Sure.
Yeah. The role of the legislative committee. The legislative committee meets to discuss all proposed legislation that has direct impact on the board's mission. The committee members review the proposed legislation and recommend a position of support, oppose, or watch. The committee is authorized by the board to act on legislation between scheduled board meetings. Such action will then be ratified by the full board at its next scheduled meeting. If the proposed legislation is progressing rapidly through the committees of the legislature, the executive officer or designee shall consult with the committee chairperson to obtain direction and implement a position, send letters, testify at hearings, discuss with legislators and/or their staff, etc. This allows a timely response to newly introduced or amended legislative proposals. Such action will then be ratified by the full board at its next scheduled meeting.
And once again, we're not trying to reinvent the wheel or appropriate or request authority that wasn't historically already addressed by this board. We just want to, in the interest of having a robust committee structure, move forward, and that was the boilerplate that council just read for this document.
Yeah, I'm not surprising, I don't like the language that is in the sunset report, so. Maybe the compromise then is to leave the expeditious line, the expeditious paragraph, but then take out the broader, the committee is authorized, well, maybe it's the same thing, I'm not, the committee is authorized by the board to act on legislation. I don't know.
But Rebecca, what you just read, isn't that similar to what
No, it's a verbatim.
is here?
Yeah, but it's the sunset report, it's not,
Yeah.
it's a report to the legislature, it's not a,
It was,
It says
It
the
was
role
the-
of the committee.
it was the role of the committee as described and submitted in Sunset. If you look at your practice, your policy manual, that description's a little different. And your 2010 description of your committee is also a little different. The 2010 description more closely matches your current policy manual, which says, well, actually, I can skip the 2010 version and simply go to the description you adopted this past October in your policy manual.
yeah, I have it, it's page 12.
Yeah.
Legislative and Regulation Committee created to review proposed and pending legislative and regulatory changes impacting the board and develop board positions. Committee members, the executive officer, and staff represent the board at legislative hearings. Like, that makes sense to me, that's a much,
And that more closely matches your 2010 Sunset submission. Or, excuse me, it's your 2014. It looks like it was originally 2010 and submitted in 2014 as well.
So is developing the board positions, the same as speaking for the board outside of the full board taking this position?
I would say it's not.
Because the development is, you're developing it, and the way I interpret that is you're developing it and then you're bringing it back to the board
yeah.
to take a position.
So I think this is one of those things where the devil's in the details and the wording, so maybe we should take it back and work on it a little more, and then we can look at it again. And I'm happy to see it, try to look at a draft for folks, or even try to work on it if that's helpful to people, and I'll redline it. Or John Deerking can do it, that's fine. I'm teasing, Mr. Deerking.
John?
Yeah, what's that now?
No, I was just saying, I think for something like this, the devil is in the details, so the exact wording, and that's important. So I was suggesting, because, I mean, maybe not, maybe I'm in the minority and people want to just move forward to it, but what I hear people saying is that there's questions about it, and so maybe we take another pass at it, and then present it next time, or.
I would defer to Todd.
Okay, yeah.
I mean, I would go with this version, deleting the two sentences in the paragraph after the completion, leaving the rest of it, and adjusting it as needed. If, we find ourselves in a situation where, hey, this needs to be adjusted, or this went differently than we intended, I think we have a good document to get us through. And I think we have the ability to, have this committee actually take effective action. Just so
No, I agree. Could you, again, just so it's clear, specify what language you would omit?
Okay, so in the paragraph that starts after the completion?
Right.
Okay. Strike the two lines following support, oppose, or watch.
Right, per Mr. Ma's suggestion
Then-
or observation.
Right, leaving the rest of the document intact.
I would agree with that.
I might ask for clarification, when it says, so that's a big turn when you go from the first paragraph to the next, where at that point, if it's progressing expeditiously, now the committee is sort of being authorized to implement a position. So I think for clarification, it could be helpful to understand what expeditiously might signify that would cause that to flip, that would cause that authorization to take place.
I think.
If
You
it's
wanna-
anticipated, I don't know, my thought would be just to define the term or give it a little more clarity. If a matter is anticipated or expected to be acted on within some period certain by the legislature or committee, yeah, right, prior to the next board meeting, that's how I would define the term.
Yeah, because I think that's the same type of criteria that the executive officer or designee would use.
Because towards the end of session, it doesn't fall near board meetings, does it? The way the sessions go? I'm trying to think.
You know, and you know, in looking at the legislative calendar, I thought I think it was January 20th was the final date to submit bills. I think it's actually later in February to get the final language up there. And I've been checking certain bills to see how they've evolved, and seen some come up that I didn't expect to see come up the way they did.
So do any other board members have discussion on this?
I'd like to hear from the board members we haven't heard from.
My position after hearing discussion is that I agree with Member Ma's comments. I think we would be better served to be more cautious. I don't know if there's necessarily a rush at this point, and I like the idea of it going back, looking at it again, and then bringing it back at the next board meeting. I don't know if there is the necessity to have something done today.
Samantha, do you have an opinion?
Nothing more than what I said earlier, which was I was interested in the opinion of the Ledge Committee themselves. I do believe it's important for the legislature to hear directly from board members, from this board itself, and without diminishing the authority of the full board, I guess what I would say is I feel comfortable with it as written with our current two committee members, but these two committee members aren't going to be here forever. So I don't know who will be on the committee in the future. I might not be so accommodating. So, yeah.
I haven't mentioned much on this. I've been listening very diligently to my colleagues. And given how rapidly some laws can go through, I have to also agree with former President James Perez. I do trust implicitly the members on this committee as much as I also trust all the members of the board to act wisely, because in the letter it says, progressing expeditiously through the committees of legislation or regulatory process, the executive officer or designee shall consult with committee members. So they're not working independently, but they're working in concert with the executive officer to begin formation of either support or opposition, and that the executive officer can, and I'm not sure if this is legal or not, so I'll ask counsel, but the executive officer can designate that she's met with the committee and relay their position to the board members for full board vote, either by teleconference or by email, if this is legal, to be able to consolidate, approve, or oppose the planned response to legislation. In some cases, it can be very important, the effects of the laws on our board. And a quick response is the agility to move quickly depending on how fast the laws are going. But the other thing my colleague, Mr. DeBronstein, has stated, and I agree with him wholeheartedly, we're either going to have a seat at the table or we're going to be dinner. And if we're not agile and able to respond in concert to prepare a response, and I'm saying prepare, not implement the response, we could be left in the dust and be presented with this law or this legislation as fait complete, where we don't get a chance to say our say before it's already enacted and signed. So in that regard, I would ask to retain the agility, that the two members are not working independently, but they would work in concert with the executive officer, who is then charged to get input from the entire board and then proceed, but the mechanism to have a response has already started so that we are not playing catch-up. Thank you.
With that being said, Rebecca, I think that might be a violation because the communication with the email and notice about legislation, if we're going to respond to the email or being notified of it.
Yeah, so if what you're describing is this update going out to all the board members, or even a majority of them, Section 11122.5 describes a meeting as any congregation of a majority of the members of a state body at the same time and place to hear, discuss, or deliberate upon any item within the subject matter jurisdiction. So receiving an update of that nature sounds to me like it would be a violation.
Would it be, if they're just sending out an update, but if we're responding, that to me would be
That would be further
Violation.
problematic, yeah.
But if just noticing us of the escalation of the legislation, just for nobody to respond,
That also sounds like it would fall within the description of a meeting, which would then require notice. Now, of course, notice can vary depending on what types of meetings are needed. So, you know, in other words, if something is sort of urgent, there are methods under Bagley-Keene and Your Practice Act to allow you to convene with varying amounts of notice. But what you're describing would qualify as a meeting.
So I think I just want to kind of figure out where we're at. It sounds like that we have this document. The intent behind the document was to give a platform for the committee to be able to respond to regulations and legislation. The angst over it seems to be in that this document gives the committee the ability to do that on, without consulting the full board, and give an opinion of the board by these two committee members. It's further complicated by, we have full confidence in the two members that we have now, but we may not have that moving forward. The committee members are appointed by the board president, so we have some control over who goes on what committee. I'm just looking for a way to move through this, because otherwise, everything's going to come back to this full board, and we're not going to be able to get things done. I have full confidence in Todd and John to be able to understand the regulations and to report back and to act on my behalf, and trust that they would do so in a manner that would be fitting to the board and the protection of the public. So I don't know if that helps people. You know, we do have control over who's on the committees.
And I wonder if we saw that this document wasn't working for the board has the ability to update and change it, or further review it. And I agree that, you know, yeah, I have the board's best interest at heart. And I think whoever was on this committee would share that same interest and vision. So I'm comfortable moving it forward, also with the feeling that if the board saw bad decisions coming out of this committee, they would make an adjustment.
John?
I wasn't sure when I stated earlier, you know, what was legal or not, but one other thing is that the EO can consult with the two board members to determine a possible response to legislation and begin the wheels moving to form that response, and then at the same time, notice a board meeting, you know, the 10 calendar day board meeting, so that instead of waiting for a response from the full board, we can begin the planning of the response, and in those 10 days before the actual meeting, be able to present the board with what we anticipate or what we have planned thus far. 10 days is not a lot of time to get deep into the weeds of something, but at least we can take a look at what the plan has been progressed so far on the response, and gives us enough time to say continue or stop and we need to modify, or we disagree with the course that's been selected and we want to go in another direction. But that occurs only if the two members consult with the EO, develop a plan, start moving in that direction. That also gives the board time to review the notice, why we're calling for the meeting, what the plan is, so that when the meeting comes, they're fully versed on the topic, which way it's going, and can speak intelligently on the topic immediately rather than wait for the full presentation, because we know what's coming, which way it's going. We either agree, disagree, or modify. So if we keep it the way it is now and use the 10-day planning to prepare for a full presentation, and the committee members, or excuse me, the full board is aware of why we're meeting and what the plan is, we could use the time wisely to prepare. That way we are 10 days ahead of the game, rather than waiting for 10 days and then begin to implement the planning and the preparation.
I would add that, as Mr. Ma has said, the board could do that on a special meeting, which is a 48-hour notice meeting.
I'd also like to add that it's weird that then it says such action will be then ratified by the full board as its next scheduled meeting. Well, what if the legislation's already passed or failed at that point? Like, why even bring anything back to the board if two people have decided they've taken a position? I mean, that seems unnecessary. And like I said, and awkward.
Well, it would be, especially if the full board decided they didn't want him to do something.
That's right.
And it was already done.
That's right.
So,
Let's just work on the language again, and bring it back.
Todd?
Well, I think the committee's recommendation is to put this through with those 2 lines deleted. So let's, I think, put that through, see what happens out of that, and then go from there.
So-
Because I think the board, you know, can agendize this for modification in the future, no matter what happens with this next vote.
Let's vote.
So in order, maybe to clarify the motion, it sounds like the motion currently on the floor from the committee members is to adopt this role of the Legislative and Regulations Committee scope statement that has two sentences in the middle paragraph deleted as discussed, and then I believe expeditiously has included some notation about before the next board meeting, and nothing else has changed.
I think that's right. I think that's the motion.
It's the motion on the floor.
So the motion's on the floor, and that was seconded because it was the two-member committee, correct?
And I believe the amendment was agreed to.
By Mr. Durking.
Can you restate the motion, please? Because I thought there was something, I think there was discussion about the wording, implement a position.
There was. Originally, the discussion was to change implement to recommend.
Right.
I believe the motion, eventually then the motion that stood was to leave it as recommend. So,
Is
or
that,
excuse me, yes, thank you. I believe it was to leave it as implement, but again, I'm attempting to clarify as well.
so Todd, was that your understanding?
Where you're talking about obtain direction and implement a position
Yes.
Yes.
is,
To leave it
yes,
as
to leave it,
implement.
yeah, to leave it as
And
it's written.
John, are you good with that?
Yes, I am.
So there's a motion on the floor, it's seconded. It came from the Legislation Committee for the role of the Legislations and Regulations Committee as changed with the paragraph starting after the completion, the last two sentences were stricken, and then the rest of the roles stay the same. So we'll start with a roll call vote, starting. Oh, any public comment?
Madam President, I think was there clarification of the expeditiously part?
Yes.
Yeah, there was,
to
Mr.
the
Durking
next
had said, make it depended on the,
Prior to the next board meeting?
yeah, if it was going to be acted upon prior to the next board meeting.
I take it that meant prior to the next regularly scheduled board meeting.
Yes.
Yes. Seeing no public comment, any further discussion by the board? So we'll take a roll call vote, starting with Eric.
I'm a no.
Todd?
Yes.
Andrew?
No.
Samantha?
Abstain.
I'm a yes. Bernice?
Yes.
John?
Yes.
Donna?
Yes?
John?
Yes.
So motion carried with 6 in the affirmative, 2 noes, and 1 abstain. Okay, now,
Prior to the next.
where am I? We're at agenda item, wasn't that the 30B? Oh. Agenda item 30B, the update on the sunset question regarding merging of BVMPT with other occupational licensing boards or continued existence as a separate board. Todd?
John, do you have that one? 'Cause I know we had discussion on it in the committee where we reviewed an email that this point was resolved. But I didn't see, can't find it in my packet now.
Perhaps the acting EO can comment on that.
Okay.
I thought I saw something from the BRN.
Are you talking about on page 2, Todd? Is that what you're looking for, the language that's there?
Which one?
Page 2,
Of,
this, your minutes. It says discussion and possible action on sunset question regarding merging BVNPT. The page over.
So it was
At the very
my,
bottom.
I thought I read something somewhere that There was a letter from the BRN that they're not interested in merging with the LVN board. That's the,
It is my understanding that there are many letters floating around that many different agencies, not necessarily agencies, no, not the boards and bureaus, the other, like CNA and other
Unions?
entities are not in favor of that also.
I mean, I remember Kamika sending an email, I found it, now I'm wondering if that's a meeting, but putting that aside for a second, saying that from one of the lobbyists, and they said basically, we do not have to worry about a merger anymore, quote unquote, and that was from an email January 5th of this year.
Samantha?
Yeah, I remember also that email. I know things change quickly and in Sacramento, though. So I think there's no harm, and we actually should make our own voice known that that we're in opposition to that, and that we believe it's in the interest of VNs and PTs and our licensees and protection of the public to remain a wholly separate board governing our own licensees. So I would, so if it's not already in there, I would move that we have a letter written under the signature of our president for actually stating our opposition to that.
I would second that.
I agree. I echo what Samantha says. Any other comment?
Is that a motion?
Does that require a motion? Okay.
Say I moved it, I seconded it.
Yeah. I'm a legislative appointee, I will abstain on this.
Any public comment? Seeing none, there's a motion on the floor to have a letter drawn up in regards to the merger, saying that we're in opposition to it, in regards to merging with any other occupational licensees. Any further discussion from the board? Seeing none, we'll do a roll call vote.
Wait a minute. I'm sorry, who's going to draft the letter, Madam President?
Board staff.
The board staff would draft the letter.
Okay, so we'll direct board staff to indicate this board's opposition to merger.
Correct. And then Eric, you're abstaining?
When the vote comes, yeah, I'm first. Yes, I abstain.
Yes.
Okay, Todd, yes. Andrew?
Yes.
Samantha?
Yes.
Myself is yes. Bernice?
Yes.
John?
Yes.
Donna?
Yes.
And John Durking?
Yes.
So it is 8 in the affirmative, and then Eric is abstain. So the motion passes. So if board staff could draft that letter for us. So now we're at agenda item 30C from our legislative committee.
So I'd just like to ask the legislative committee if they digested those 20 bills and if they could give us an update on what they say?
Briefly.
Okay, so the 20 bills before you were digested over the last few years because these are all from the previous session. And with moving forward, I'm going to be drawing your attention to item C2, item number D. It's SB 1155. That was a bill that we supported last session, and I think it would be wise if we showed support again. It has shown itself in a new form under SB 27. It's by the same author. It holds the same basic language, and I would offer up that we support that bill, again, relating to professions and vocations licensees with military service. So,
Madam President, as
Yes.
a veteran, one of the two veterans on this board, I second that motion to renew our support for this bill.
There's a motion on the floor, and there's a second. Is there any public comment in regards to that motion? Seeing none, further comment from board members? Seeing none, we'll do a roll call vote. There's a motion and a second to support, draft a letter in support of the bills SB 27 in regards to the licensees, professions and vocations licensees, military service, for board staff to do that.
It's listed on the handouts, SB 1155. I just want to make sure we have the right bill.
That's correct. It's from, 1155 is from the previous session.
Thank you. Just want to be sure.
So the new session is SB 27,
Yes,
Todd?
yes.
So it would be in support of the Senate Bill 27 for the military service licensees. And we'll do a roll call vote. Eric?
Yes.
Todd?
Yes?
Andrew?
Yes.
Samantha?
Yes.
Myself is yes. Bernice?
Yes.
John?
Oh, definitely.
Donna?
Yes.
And John?
Yes.
So that passes unanimously. Is that the only bill?
I have a question on another bill.
Okay, Donna?
So, did you guys look at AB 1939? And the reason I'm asking is because we're looking at removing barriers to labor market entry. Did you guys look at that at all? And the reason I'm asking is I'm not opposed to curriculums being adjusted and all of that, but I have had a number of people say, why do I have to have so many hours when our LVNs have more hours than some of the others? I believe our LVNs have more clinical hours than the RNs do. So I'm wondering if that fits into this AB 1939, or if you guys looked at it at all.
Are you looking at the item D under Assembly Bills, 1939?
Yes.
Okay. I can address that. We are expecting bills to come out of the Little Hoover Commission meeting that was, for lack of a better title, it was their report 234, Jobs for Californians, Strategies to Ease Occupations and Licensing Barriers. So out of that Little Hoover Commission meeting, there will be proposed legislation, and as of yet, I've only heard of how legislators will adapt some proposed bills currently, and I know there is a workforce bill coming out of the AB 227. It's a CalWorks appropriations bill. I know that's one that's coming. And I would, at this point, just recommend a watch on that.
Tammy, I have a question.
Thank you.
Samantha?
Yeah, I'd also like to make a comment on that. As far as the Little Hoover Commission and the hearings they had, they also visited the BVNPT. We actually had a meeting with them. I was on teleconference. Dr. Brown was there, and I think Andrew was maybe there or maybe not. And so we actually met with them. We invited them over to the board and met with them. And one of the first things they asked was, why shouldn't you be combined with another board, or why should you continue to be a board at all? So we gave them some good information, and we had a good conversation, reciprocal conversation with them. But I would just ask the Ledge Committee to please watch, because some of that language may pop up in some legislation connected to Little Hoover. And I think this board has already said we would absolutely oppose being merged with another board, but that we would also absolutely oppose being reduced to a bureau, or take this board's independent authority be taken away. So I would just ask that Ledge Committee please watch that closely.
All right, and Let me just ask legal, the other bills that are potential watches, should I wait for the future agenda items, or should, okay. That'll conclude what I have.
And there's no
From the
further
Ledge
action required on any of the other things on there? Okay. So that brings us to agenda item 31, public
I'm sorry, go ahead.
Okay.
Just bumped you on accident there.
So that brings us to agenda item 31, public comment on items not on the agenda. Individuals may appear before the board at this time to discuss items not on the agenda. The board may not discuss or take any action on any item raised during this public comment section, except to decide whether to place it on the agenda of a future meeting. And that's per the Government Code Sections 11125 and 11125.7A. So I will now entertain any comments from the public. I see none. Any discussion for with the board members?
Are you on now basically 32 and 33, or no?
No, now
All
we're
right.
going to 32. I see none, so we'll move to agenda item 32, which is the future meeting dates. The board will discuss and take possible action on future meeting dates. So the 2017 board meeting dates and location. So obviously, February 8 to 10, 2017 is San Diego. May 11 to 12 is Northern California. August 24th and 25th will be in Southern California. And November 16th and 17th is in Northern California. Any discussion? I thought we voted on these.
It's just the November date that's
10th and
changing.
11th, right?
I mean, this board already
I
agreed.
thought we already,
It's just the
took
November, it
action.
looks like the November
August
date
2018.
changed.
so the November date changed?
That, Samantha's correct.
It was November 9th and 10th.
Oh,
was
okay.
9/10.
That's right. So is it appropriate for me to make a motion to accept the future?
I mean, I think so, especially if you're going to change a date, it doesn't hurt.
Okay, so I will make a motion to accept the 2017 board meeting dates as such, May 11 and 12 in Northern California, August 24 and 25, 2017 in Southern California, November 16th and 17th, 2017 in Northern California.
August 24 and 25.
Second.
There's a motion and a second. Any public comment? Seeing none, any further discussion by the board?
Madam President, is it possible, just because it requires, I have to take vacation in order to come here. And I put my vacation in a year in advance. That year includes the February, so I'm always at risk of not being able to attend this meeting because we don't have the February board meeting, February 2018. Is it possible to include the February 2018 board meeting so that I know what days I'm requesting? Because I have to put that in.
Do we have, I don't know if that's a question for Jennifer. So
What dates do you want?
for February,
I know, but we don't.
proposed date for February.
2018.
Well, you have 1, 2, 8, 9, 15, 16, or 22, 23. Dealer's choice.
Traditionally, it was the second week, no?
Yes, I think so. 8, 9.
So
It's a push, if you can possibly push it to the third week, that would help.
One thing, I don't know if staff can confirm, what I heard in the past was because of Valentine's Day, it was sometimes hard to get big rooms. If there was a depending on what day it fell, that there was events,
Weddings.
and events and things like that, so that might be a consideration.
I'm good with any of them, I just need to know. Day after Valentine's?
Donna, does this change in November mean you can't attend the November meeting?
No, she just wants a future February date so that she can request time off.
No, I understand, but do you understand, can you attend the November meeting
Yes,
with the
because I
change?
can- I put those all in now. The problem remains is when because I have to have them in.
Okay, as long as you can, the new date in November is good for you.
Yes.
Okay.
Yes, yeah, that's fine. It's just I need to have the February meeting.
Got it.
I mean, my employer is very gracious, but if I want to be sure that I get it off, I have to put it in a year in advance.
So, Jennifer, 15, 16?
That's right after Valentine's Day, that's the weekend.
Is that going to work for the board? Because that's right after.
That would mean you'd be coming down here on Valentine's night.
Be on Valentine's Day?
Yeah. I'm good with 8th and 9th.
Director form will work out. It's whatever the board wants.
Well,
So-
maybe you'll get one by then.
8th and 9th?
No, that's too soon. And the reason,
That's where we are.
the reason I know, but you have no idea what we went through to get to this. We don't get the data, the statistics that you need to make your decisions don't come, and we have those until the end of January, the middle to the end of January, before we finish all of the QA. And then it's a matter of factoring them in. So that's why I'm saying, please, not the 8th and 9th.
So how about the
So-
23rd, 24th?
That would be fine.
I mean, the 23rd, 24th avoids I'm on the wrong year already.
When's President's Day?
So the 20,
22, 23,
22 and 23, February 2018.
yes.
Everyone's going to be in a bad mood.
That's what I was thinking, especially because the staff has to come from Sacramento. That means they're leaving on the eve of the 14th, and that's not okay.
22nd and 23rd?
I mean,
So-
that's another point. Why don't we do most of our meetings in Sacramento? I mean, I know we have a tradition of splitting it, but I think in our policies, it only says a minimum of one meeting in Southern California. I mean, I think in terms of cost and burden on the staff, it'd be easier to do 3 in Sacramento and 1 in three in Sacramento and 1 in Southern California.
Most of our students are down here. We seem to have much better turnout.
But now it's webcasted. Even the disciplinary hearings are webcasted.
I think it's in statute that we're supposed to go north and south, north and south.
No, like I said, I've read the statute. It's a minimum of 1.
Is that possibly we can?
Would it also be more cost effective?
It's certainly more cost effective.
I
to
can
do it
see
in
that.
Sacramento.
Because the majority of the staff and everybody is in.
And the burden on the staff to travel and their families, and there's 8 or 9 of you here, 10 of you, 12, I'd prefer Northern California for that.
It works for me, I can sleep at home every night.
Okay.
But what about the schools?
But is that something that we could?
Do we need public comment on that?
I just have an observation. We do have those who come before us. And in some case, the question would be, could anyone give us some feedback on what burden that would present?
For the licensees.
Yes, for licensees. Or would we be
Schools.
willing, if we only do one Southern, to extend the time so licensees in this part
In this
of the
region.
state could actually come with fewer or less costs?
Are you referring to the petitioners?
Yes, I
Yes.
am.
I see.
But one possibility may be to hold just the disciplinary portion of the meeting down in Southern Cal, or split those up, between different parts of the state.
Are not most of our schools in Southern California?
Yes.
Yeah, so wouldn't it be a burden on the schools to have to fly up to Northern California to come before us?
Again, this is
I'm-
go ahead.
I'm wondering if that might be a better discussion to post on a future agenda item as far as discussion of dividing the meetings.
It's fine, that's fine.
Please.
So we'll place that in regards, in a future agenda item. But for the purposes of this, our future meeting, and then we can adjust the locations at that point if we need to. For 2018. John?
Another thing, since we're on agenda item 33, it's been pointed out to me by
We're not
one
on
of
33. We're on 32.
No, we're on the board meeting dates.
Oh, I'm sorry. My apologies.
I just suggested that because that came up in our discussion with the dates.
Sorry about that.
So I'm going to amend my motion to add the February 22 and 23, 2018 meeting date.
And I accept as the second.
Any public comment? Seeing none, any further discussion by the board? Seeing none, we'll do a roll call vote. Eric?
Yes?
Todd?
Yes?
Andrew?
Yes.
Samantha?
Yes?
Myself is yes. Bernice?
Yes.
John?
Yes.
Donna?
Yes?
And John?
Yes.
Okay, that's unanimous. Motion carried. So that brings us to agenda item 33. Wait a minute.
34.
Oh,
No.
34, no, 33. 33. I just got a
I
little
have-
confused because the public comment was there and that was for future agenda items also. But anyway, any suggestions for future agenda items
3, 4 hands up.
other than the meeting locations? Donna?
I would like to look at the regulations for work requirement limitations for reinstatements.
So I think specifically in the disciplinary guidelines, you're
Yes.
referring to term 8.
Yes,
Thanks.
a portion of term 8.
True.
Ditto.
Todd, or John?
Thank you. I'd like to bring up for consideration, switching the topics on Thursday and Friday, have the board meeting on Thursday, reinstatement on Fridays, because Fridays seem to be running really long into the evening, and people have flights to catch. And if we do the reinstatement hearings on Friday, we have a little bit more control over our schedule when we go into closed session. So I'd like to at least consider the possibility of switching the days around, or the contents.
Any other board members have any?
I like the idea, and I have some agenda items, or maybe it's a request. One, I know the board staff is stretched. I'm sure the 50,000 envelopes you have to open don't help, but really when we have minutes that are 4 or 5 meetings old, it's really tough to remember what happened, and I think we should prioritize them if possible. And it's not meant as a critique of the staff here, but maybe a request to the leadership, to the executive officer, that minutes are important because we do refer to them, and, we have cases that come up, and seeing those minutes, I think, is really important. I'd like to try looking at re-reviewing the administrative manual. There's some language in there that I think is ambiguous. One in particular suggests that the board members cannot speak to staff or discouraged from speaking to staff, and I've heard lots of different things about that. I have honored that, even though I want to often talk to board staff about various things, but I tend not to, and I'll go through the executive officer, but that makes me a bit uneasy because I would like the staff to know that we are available and accessible. So for those of you, not the staff are watching this late, but sometimes even if a staff member, anyway. So, okay, so that's that. And that's all, thanks.
Todd?
Yes, it'll come up in the legislative report, in our following meeting, but I wanted to make people aware of AB 316 from Waldron, I believe that also relates to workforce development. AB 227 from Mays is talking about a CalWorks appropriation, and in there is worded some language related to vocational programs. And then SB 227 from Monning, it's that was the bill about LVNs and tube feedings, I believe, in the community. So, and I'm sure at the next board meeting, there will be plenty more.
Any other future agenda items from board members? Seeing none. Thank you for the future agenda items. As stated previously, we can't take action on them. We'll just, anything that was not included on the agenda. Now we are at agenda item 34. Okay. We got 34A, the board will convene in closed session pursuant to Government Code Section 11126A1 to consider and, if necessary, take action regarding selection or appointment of acting EO. And 34B, the board will convene in closed session pursuant to Government Code Section 11126A to confer with and receive advice from legal counsel on pending litigation.
Taking a break till the next meeting.
So at this time, if we could have everybody that is not authorized to be in closed session, clear the room.